Morning, everyone. Welcome to Power and Pandemic, a conversation about health, equity, and utility shutoffs in the time of COVID. I am going to go ahead and have Melissa Jones pass the mic for some opening remarks.
Yes, welcome everybody. Thank you for being here with us today. I am Melissa Jones with BARHII. We are the coalition of the Bay Area's public health departments focused on issues of health equity and fire. Mari Rose, if we could get you to mute the line. So welcome, I am Melissa Jones, executive BARHII, and I'm thrilled to be joined today by Mark and Gabriella for a conversation about, looks like was I just remuted?
We can hear you.
Okay, with a conversation about power and the pandemics. And so I guess I just want to take a moment to welcome all of you who have been on the front lines of emergency response. In this moment and over the last really 5 years that I've been at BARHII, seeing a very constant set of emergency responses that need to happen around fires and around other things. I think actually in today's present moment, we're in one of those moments when it becomes much more obvious to everyone else the boulders that public health departments and emergency response units have been trying to push uphill, often in silence, often unseen, and taking an incredible amount of effort. And so a lot of you are probably like me. I'm here in Oakland. You know, I have a nephew out at protests and a lot of my own personal feelings about what's happening all across the country. And I think it's moments like this one where we've got massive protests, where we're seeing COVID-19 response really taking everything it's got for health departments and other responders, healthcare to respond. And the fire responses we've had over time to remind us, really not remind us, but to make clear to others how much work there is that happens behind the scenes and is to get done. And I think we're in probably the most important conversation we'll have on this topic, which is the fact that our emergency responses are going to be co-occurring. They're going to be occurring in a moment and impacting those most vulnerable in ways that are different than ever before, right? And so in particular, the added complexity of the power shutoffs and what that means, particularly for those who are medically vulnerable or for those who are stuck home for long periods of time during the COVID-19 stay-at-home orders, is going to have a whole different effect on how we manage emergency response in this time. So we're in a moment where we know that some of the communities most impacted both by emergency response, fires, COVID-19, are also the same people who were least likely to be staying at home during the shelter-at-place orders, that were most likely to be essential workers and going into work, sometimes in workplaces that hadn't prepared for their safety. We know that many of the people most highly impacted by these same items are the same folks who have been struggling with high housing costs for a long time and least likely to be living in places where they can easily self-isolate. And we know that there are a number of communities highly already impacted by health disparities that are, again, going to be highly impacted by power shutoffs. And so it's these pressures, not just on our public systems of these co-occurring responses, but on communities and individuals and families, that I'm excited that we're going to talk about today and come up with some solutions for. I just want to, I guess, start with an acknowledgement of all of the incredible work I've seen in fire recovery response over the last few years with the health departments in trying to figure out what to do about power shutoffs that didn't have long notice periods that people had to respond to quickly. And now to the COVID-19 response that will linger for quite a long time. And so I want to appreciate all the work you do, and look forward to having a conversation with you about how probably in emergency response more than any other area, the silos that our systems are structured in are busted for families, because there's so much that happens to us all at the same time and has huge impacts on our health. So thank you so much for being here to figure out what the solutions are for that scenario. And I look forward to a great conversation. And I'll turn it to Gabriella, who has been doing incredible work thinking about how to organize a conversation that takes the best use of everyone's great thinking and experience in this area.
Thank you, Melissa, for your opening thoughts. I really appreciate that boulder metaphor. I think you're right. We're pushing not just one boulder, but multiple boulders up some pretty steep hills. Turn is also very great. Very grateful for BARHII's partnership and for bringing such an important equity lens, not only to the problem of energy insecurity, but to so many other important issues facing the Bay Area today. My name is Gabriela Sandoval. I serve as the Director of Strategic Initiatives with the Utility Reform Network, or TURN. TURN believes no one should be cut off from essential electricity, gas, or phone service. We hold utility corporations accountable by demanding fair rates, clean energy, and strong consumer protection. 4 years ago, we launched the Power at Home campaign. This is a campaign to end shutoffs due to inability to pay in California. Since then, PG&E began using large-scale preemptive power shutoffs in an effort to prevent wildfires. TURN pivoted to address this issue because we acknowledge that any shutoff is detrimental to the well-being of the people left without power. And both types of shutoffs must stop. This year, we will face wildfire season in the midst of a major public health crisis, the novel coronavirus pandemic. We know there are many unresolved questions with respect to how these co-occurring crises will be handled. So we've brought together a group of stellar speakers and participants from public health and energy policy, disability rights, and healthcare to help push the conversation forward. Before we begin, I'd like to take a moment to dedicate this event to Stacy Park Milburn. Stacy was a disability justice organizer who lived in Oakland. Her political work focused on her experience at the intersections of race, ability, gender, and sexuality. She passed away on May 19th, 2020. Stacy helped form the Power to Live campaign. This was a grassroots campaign launched in the days leading up to the October 26th blackout conducted by PG&E last year. As many of you know, TURN and BARHII planned to host an in-person gathering back in March, and that event would have brought together disability justice advocates, public health leaders, energy justice advocates, among others. Stacy's work with Power to Live and the Disability Justice Culture Club strongly shaped the planning of that event and will undoubtedly continue to impact our response to planned outages for years to come. So I am going to just do a quick overview of some kind of tech instructions. Now, at this point, most of you probably know that the mute and unmute button is in the left lower corner of your Zoom window. Please mute yourself if you're not already muted. When it's your turn to speak, you'll be able to unmute yourself. Next to the mute button is the video button. We encourage you to use your video to help us feel connected in this virtual space. Next, over to the right is the participants button. You can click here to see a list of everyone in the conversation. Then the chat button is right next to the participants button. You can click here and send a chat that's visible to everyone, or you can send a chat to a specific individual. If you have any technical issues, don't hesitate to chat directly to one of the meeting hosts. To the right of, further right of all the buttons before you leave the meeting is the reactions button. If you click here, you can indicate that you're clapping or give a thumbs up to what you're hearing. Next slide, please. Please use the chat button now to let us know who's in conversation with us. Click the chat button and send us your name, the organization you represent, and your email address so that we know who's here with us. I'll give you a moment to do that. We had folks registering right up to the last moment for the event, so welcome everyone. Now let's talk about tools for joining the conversation. There are a few ways for you to share your thoughts and questions. One way is to unmute yourself and ask your question. To help us manage that, we encourage you to raise your hand. You can either physically raise your hand, so we'll see you in your video, or click participants and look in the bottom right of the participant list for a button labeled raise your hand. You can also write your comment or question. We're using a tool called Padlet to gather written questions and comments, and you can see the link on your screen for how to access the Padlet page. You can also see other questions that have been asked up until now. Panelists to whom the question is directed will respond, and then other panelists will have the option to follow up as well. All right, we've created a simple poll to give us a flavor of who is in the room today. We'll launch the poll now. You should see it on your screen, and I'll give you just a minute to respond. Should be coming up. No? Are we having trouble with the poll? So it looks like some people are seeing the poll and others aren't. So I
saw it when I first came on, and so I responded at that time. So some of us may have already responded.
Okay. Well, I'm going to move forward. I'm going to push you forward here. Siobhan, if you wouldn't mind putting back up the speaker slide, that would be great. Okay. So, Dr. Karen Reluccio serves as Napa County's Public Health Officer and Public Health Director. She chairs the California Conference of Local Health Officers, an organization of the 60 legally appointed physician health officers in California. Ms. Stella Fogelman has been working for the Ms. Stella Fogelman has been working for the Los Angeles County Department of Public Health for nearly 19 years. She's the director of the Emergency Preparedness and Response Division and leads the department.
It's a symposium on emergency.
Sorry. She's the director of the Emergency Preparedness and Response Division and leads the department's readiness and response activities for emerging threats and natural disasters, as well as acts of biological, radiological, and chemical terrorism. Next, we have Dr. Mark Toney, who has served as Executive Director of the Utility Reform Network since 2008. He describes himself as an organizer by trade, a sociologist by discipline, and a troublemaker at heart. And finally, we have Maribel Batcher, who was named President of the California Public Utilities Commission in July of 2019 by Governor Gavin Newsom. She leads California's effort to hold utility companies accountable to providing reliable power that is safe, clean, and affordable. We'll open the discussion by posing a question to each of our experts. From there, I'll move on to questions sent to us in advance of today's event, and then open it up further for more questions. Just as a reminder, if you are a party to a commission proceeding, you may identify the proceedings in which you are involved, but ex parte rules prohibit us from speaking about the policy arguments. Okay, Dr. Reluccio, I'm going to start with you. Napa County has been a leader in responding to the planned outages. Can you share a few highlights of what Napa County has done to address the health equity impacts of power shutoffs?
Yes, hi, thank you for having me today. Napa County has been involved since the beginning of the power shutoffs when one of our hospitals in an area where a power shutoff was happening was going to be affected. And we had observed that the notifications were really spotty, and it was also difficult to get a better understanding of how many people were affected by the response. We found that the medical baseline list was woefully inadequate and did not reflect the number of people that we had listed in our in-home supportive services list. We actually have gone through 7 different power shutoffs, with subsequent lessons, we have learned ways in order to improve response and to improve health and to improve the health inequities that are prevalent with public safety power shutoffs. First of all, we decided to work internally in our health department with our in-home supportive services providers, our California Children's Services that serves children with disabilities, as well as working with the Empower database, which is a Center of Medicaid Services database for people that are on durable medical equipment that is power dependent. We started using that data and overlaying that based on what the power shutoffs would be. So this would create a lot of work that we would activate our Emergency Operations Center for. Basically, we decided to prioritize the highest priorities based on people that may die imminently during a power shutoff, such as those on ventilators and cardiac devices. And then we divided it into other categories so we could time our phone calls and outreach to people that would be impacted by a public safety power shutoff. This really entailed a lot of coordination with internal partners, as well as just understanding the limitations of how we can reach out. We worked with our volunteers in order to do that, and our community organizations active in disasters, our community emergency response teams to actually help with the efforts. Aside from the boots on the ground response that we were involved with through our Emergency Operations Center, we started doing a lot more activity in terms of engaging the county in CPUC proceedings. We worked with an attorney who was a public utilities attorney, of which several counties are working with. This is how we were able to get more involved in CPUC proceedings, mainly looking at really long documents and trying to weigh in where we could. And I felt as a health officer and someone who really is looking at health inequities as well as the health of the community that suffers through public safety power shutoffs, my main focus was looking at how we can help access and functional needs populations. This has been an ongoing collaboration between several counties that are working with this public utilities attorney and weighing in on that. Additionally, I've been trying to provide education through the California Conference of Local Health Officers, where I presented this topic twice during these meetings, just to get other health officers to understand what this response looks like and how we can help those that are going to be disproportionately impacted by public safety power shutoffs. So I just want to name a couple of health inequities with public safety power shutoffs that had been really discovered during the process of responding to this. So first of all, the medical baseline list is very, signing up for it actually is not easy. People that are unable to, that really don't know how to do it or cannot pay for a doctor's visit or a healthcare provider's visit in order to sign up for PSPS are unable to sign up for medical baseline and to advocate for themselves in order to do so. So that is an area where we were trying to work with PG&E to make it easier to work with medical societies or our healthcare systems to facilitate the process. So if someone has a durable medical equipment that they purchase, make it easier for them, help them sign up for medical baseline. The other area where we saw a lot of issues is that only master metered customers are notified of a public safety power shutoff. So this leaves off people that live in apartment buildings, mobile home parks, or other multi-unit dwellings of which there will not be a master meter for each person that lives in the building. And you're at the mercy of the apartment manager or the landlord who actually is the master metered customer. And then there was also a lot of the notification that was coming from PG&E that really did not account for people with access and functional needs. And I know that at this point, this is a work in progress. This is a long road in getting there. I just want to talk about the context of how the COVID-19 response has now added an additional complexity to public safety power shutoffs. And I have to say that when I talk about this, my heart is really heavy because before we used to be able to put on a really good response. We could concentrate our efforts in doing outreach to people that have access and functional needs issues. And we could actually find out a way to supplement the response through our Emergency Operations Center. But now all of my staff are responding to COVID-19. They're all case investigators, contact tracers, public educators, responding to a lot of lots of questions that come from people that want to open up the economy, addressing issues of health inequities that are prevalent with people that are cases that come from large families where there's a lot of exposure and they're having a hard time having their own needs met because they cannot go to work. So this is just going to be compounded on top of it, and we are not going to be able to have the same response to help people that are unable to help themselves during a public safety power shutoff.
Thank you, Dr. Relucio. I really appreciate your leadership in this space. And we have really looked to Napa County for to see what you're doing, because you really have been out front on this issue, having faced so many of these. I want to remind everyone that in these opening moments that we will have a chance to get back to these questions of notification, of medical baseline. And so you shouldn't feel like you need to kind of say everything right up front. We have a lot of great questions to continue the conversation. Stella, I'm going to turn to you. LA County has been very active in responding to power shutoffs. How has the public health department there engaged with them as a health equity issue? And what are you planning to do differently in 2020 as we face the potential for co-occurring public health crises of both power shutoffs and COVID-19.
Thank you, Gabriela. And hearing Dr. Reluccio name a lot of the activities that she's done, I know that we have watched and learned here in LA County about the responses that they have done and really benefited from them sharing their practices. As a health equity issue, agency to agency, we have Southern California Edison down here that we've been working very hard to engage with and to establish a working relationship and, get to know the folks there to establish trust relationship, because there's a lot of information that they have that is beneficial for us in our response efforts, but they don't exactly know, public health has that, the difficulty of being invisible a lot of times. So they don't know exactly what we do and the many ways that we can use their information to benefit our folks here in LA County. So as agency to agency, if it's difficult for us to understand each other, how much more difficult is it for regular folks living their day-to-day lives in their homes, just trying to make it, and also already, layers upon layers of difficulties in being able to just make ends meet and take care of themselves and take care of their families. As Dr. Reluccio mentioned, the medical, I think that the utility company thought that the best, they're really trying to do their best with the medical baseline, but really it's woefully inadequate, and that folks are invisible to their utility company. They don't know, the utility company doesn't know that they're there, and the folks don't know what the resources are for them. So to be able to even understand what that program is and to try to think about from a public health lens, what are ways that we can leverage that for people on either side? What are ways that we can make that more public so people know about what potential resources are there? And then what can we help our utilities companies understand that that could be more helpful for them, for the people that they serve, in understanding who they are, where they are, what the needs are, and really what the damaging effects are of any sort of power shutoff, how many people that impacts, how damaging that is, how deeply that impacts. We have to start with the very most vulnerable, but think about all the people who rely on medications, in their refrigerators. Think about all of the chronic illnesses of folks that are moving around, working, still doing day-to-day things, much less the people who are at home and rely very, very heavily on electricity to be able to live. There's a wide range of needs and a wide range of impacts, that run very deep with these. So to be able to be that liaison to understand the system and try to leverage the resources and find ways to reach people is just the very beginning. And we've been fortunate to be able to be active, but I feel like this is just the tip of the iceberg, the very beginning of understanding how the impacts. Things that we'll do differently for going forward. Again, with COVID, it makes things a lot very complicated. So if we're going to bring people to community charging stations, which we really don't have that many down here, it was very low on that resource. But we have to look at everything that we do now in the light of policies and practices to protect the health of the staff that are standing those up, the people who are visiting those resources, measures to implement physical distancing, we still have to do that, infection control, and then communication when right now there are just so many, our media is saturated with just how to live your daily life, and then now with the social aspects and the public unrest. So communication about what resources are going to be available to folks, and about what may happen if power is going to be shut down. And then of course, what we're talking about today, equitable access and protection for everyone as we move forward in a new hazard with this new layer of COVID about that, or along with that.
Thank you, Stella. I think you point to a really important piece, which has to do with preparation, right? I mean, even to Dr. Reluccio's point about what does this added layer of the COVID-19 complexities mean for wildfire season. So Mark, if you could tell us what kind of planning and preparation you believe should occur so we can minimize the negative impact of the 2020 wildfire season on communities, especially those who are our most vulnerable and under-resourced neighbors. What roles can community advocates play in this regard?
Well, I think that there are important things that that public health professionals, community organizations, public health providers can do to keep the utilities accountable, whether it's Southern California Edison, PG&E, or SDG&E. So first of all, think about what you can do beforehand. I recommend that you send written communications to your utility company telling them what are your expectations before the massive shutoffs, okay? What are your expectations around the people you want contacted, the key people to contact in your agency, in your organization, in your hospitals, 72 hours before there's a shutoff, okay? And who are the key people to continue to give updates as the event goes on? Also, any recommendations you have for contact and for mitigation and identification of people on medical baseline, people with access and functional needs, people who are identified as having been exposed to COVID. It's absolutely important that you put in writing to the utilities, and here's a little trick. Anytime you write a letter to the utility saying what you want them to do, it never hurts to CC the California Public Utilities Commission, your state assembly members, your state senators, your local city, county supervisors. Send a copy to TURN. We'd like to know what you're asking, because in the proceedings that TURN is involved in at the Public Utilities Commission, we like to include what is happening in the field. And if you let us know, we'll help in letting them know. So that's before. Let's talk about after. Every time there's a major shutoff, the utility companies have the responsibility to submit a report, how everything went 10 days after. The thing is that utility companies have this wonderful mirror that they like to take out. And the mirror shows them always to have done stellar. Oh my goodness. Everybody got a notification when they were supposed to. Everything just went fine, okay? And we know from what we hear, it's not always the case. So I think it's important for every agency, okay, health provider, community group, to submit their own report to the PUC 10 days after. Let them know how effective was the utility in providing the right notification to the right people at the right time, okay? They said everybody got it 72 hours. If you only got notice 12 hours ahead of time, the PUC needs to know that, okay? And what was the impact of these shutoffs on the populations you serve, okay? Any data you have, surveys that you have, especially for people who are medically vulnerable, any information you have about the overall cost impact, the healthcare impact. Were there higher calls to 911? Were there more emergency visits? Were there higher backup generator costs? Because part of what the utilities are doing is shifting the cost of wildfire management from their system out into the communities. We need to let the CPUC know what is the cost. And again, when you submit that written report, don't just send it to the PUC. Make sure you CC all your elected officials, and please send a copy to TURN. Again, we use this information we incorporate it. That's part of why we have invested in this network, why we have invested in this strategic partnership with the public health sector, because the California Public Utilities Commission has so much influence, but often people are not aware of the influence they have.
Thanks so much, Mark. I think it's really important that you give us ideas about tangible things that we can do, actions we can take. And I can see in the chat box that folks are already having ideas about what PG&E can do differently. And so I'd encourage everyone, if you have ideas, if something pops up in your head, you think, why can't it be this way or that way? Please engage us in that way. I'm going to turn to President Batcher now, because I think, you know, we have a lot to learn based on what the PUC has been doing. So President Batcher, what lessons did the CPUC learn last year that it will implement this year? Considering revised guidelines for de-energization, how will this year's planned outages be conducted differently? Oh, I think you're muted.
Sorry, is that better? Hello?
Yes, we can hear you now. Yes.
All right, thank you. First of all, Gabriella, thank you very much. I want to thank Melissa for her very thoughtful and heartfelt opening thoughts. And thank you also for dedicating this session to Stacy. It was very moving, and I thank you very much. Also, before I get started, I want to thank both Napa and LA. Dr. Reluccio, please, you've done a fantastic job, and I can't thank you enough for what you've described as your priorities. And I think in terms of those who are listening in today, many of the things that you all are doing in Napa are absolutely the kinds of things that you need to be doing. And I can't thank you enough. Same also, Stella, thank you also for the work you're doing with SoCal Edison. And you mentioned how important the relationships are. We are all very worried about how we can, in this new world in which we're living with COVID-19, PSPS are already so very difficult. How you overlay COVID-19 in terms of distancing when you have community resource centers that we need to stand up indeed, even evacuation centers. So this is stressing us, our systems, all of our systems. The public health providers are champions always, and ever more so today. So thank you. And Mark, thank you. Your comments are perfect. I do want to hear from people. We, the PUC, wants to hear from people. You're right. Sometimes the IOUs paint a very rosy picture in their 10-day reports. We know better. And we know better when we mostly hear from the ratepayers and the people that are impacted by these, the PSPS. So last year, as we all know, we witnessed failures in execution combined with the impact of the shutting off of the power, but impacted about 2 million people in California. We learned also, despite the effort to prepare the public for the PSPS events, PG&E in particular didn't incorporate many of the recommendations from the state agency and wasn't prepared to manage the impact to the customers of the large-scale PSPS events that they conducted. We learned the scope and scale and complexity of all of the impacts to people's lives and businesses to the economy really can't even be they can't be overstated, and they can't be, they were so tremendously powerful. The loss of power, as we all know, is not only an inconvenience, it literally endangers lives, especially the most vulnerable, as we have discussed already today, for those who rely on power, literally for their life. It causes major disruptions to business and medical facilities and schools and transportation, as we all know. The failures to execute well, combined with the magnitude of the PSPS events, created an unacceptable situation that we all know cannot be repeated. What we saw in PG&E in particular was that it had multiple issues with communications and customers and safety partners. in their coordination of the event and the resource management of the execution of the PSPS. We at the PUC have taken numerous steps this year to drive the utilities to do much better for their customers. With respect to PG&E specifically, we have engaged in strict oversight since their mismanagement of the PSPS of the fall of 2019. We've required a corrective action plan and have been monitoring their progress against that plan with senior management meetings with them on a weekly basis. Stop right there. Why did we have to do that? Because they're reporting, back to Mark's point, they're reporting to me, to the PUC on a regular basis, which I required after our emergency meeting with them all after the PSPS events. We're basically a cut and paste reporting. So we literally have been holding weekly meetings to go down the list of things. Where's their website? What are they doing to harden their system? What are they doing with their baseline medical lists? How are they contacting people behind the master meter? So we have been literally making them show us on a weekly basis. So with that said, we've put additional requirements from the requirements that they didn't all adhere to last year on the utilities based on lessons learned from last fall to drive major improvements in their approach to understanding the needs and communicating with impacted communities and focusing on minimizing the impact of the PSPS events as they are initiated. Some of the main requirements I'd like to highlight very quickly require them to consult with local communities, you're here today, access and functional needs representatives and public safety partners to ensure they hear directly from impacted communities and experts in public safety on efforts of PSPS on communities and incorporate the feedback from those communities into their PSPS planning. We are checking on that. They are doing it. They're not exactly right now, June 2nd, where they need to be, but they are working in a manner that's much better than they were last year at this time. We want them to expand their hours on their community resource center operations, identify people who may be at the medical risk of an extended power outage above and beyond those utilities' medical baseline rate. So go beyond understanding who is the population in the medical baseline and what the severity of their disabilities are and what their needs are. Restore service within 24 hours of the end of the PSPS event unless safety is threatened by doing so. The new guidelines go into effect immediately and require progress, that means now, and require progress reports by the utilities within 2 months, which is critical given the current COVID-19 pandemic coinciding, of course, with the wildfire season. All the utilities are adjusting to account for COVID-19. We're also checking with them on that on a regular basis. Selected actions include redesigning their community resource centers to reflect distancing requirements, and in some cases, drive-through options. Conducting community outreach remotely via open line open houses as opposed to their county meetings that they were holding in person. Adding new COVID medical facilities and shelters to critical facilities list, incorporating new COVID alternative care sites into the PSPS mitigation strategies, including potentially providing temporary generation to those sites, and updating materials, including the website that I mentioned earlier, to include COVID-19 considerations and invite invitations and capacity to all households to register for the PSPS alerts, regardless of the account holder status. A recent decision stresses that the utility should make every effort to adhere to the PSPS guidelines while complying with the public health officials' direction regarding stay-at-home orders and social distancing. I want to be very clear about one point, however. PG&E and the other electric utilities are the operators of their system. It is up to PG&E and the electric utilities to ensure that they are ready before the first PSPS event of 2020. It is also up to them to make operational decisions before, during, and after the event that comply with our rules and expectations. CPUC is doing everything we can in our role as a regulator, but at the end of the day, Achieving a state of readiness and making sound operational decisions are the responsibilities of the utilities. With lessons learned from last fire season, we expect to see major improvements in the level and frequency of their communication and impacted customers, and for them to execute the PSPS in a way that will mitigate the scope and length of impacted customers when they are called. I have some additional information on baseline, but I think I've spoken long enough, so I'll pass the mic, as we say, back to the moderator, Gabriella.
Thank you, President Batcher. We really appreciate that synopsis of those guidelines, which have just been adopted as of last week. And we're hoping to offer participants an abridged version of those for folks who are interested in learning more after the event today.
We're happy to do that, Gabriella.
I'd like to turn back to our public health partners and ask how your counties are identifying residents who are vulnerable. An issue that comes up often, both in the guidelines and from people who submitted questions, has to do with notification. One person in particular said she had been shut off for 4.5 days and did not receive adequate notice. So what are our public health partners doing to help people prepare for planned and unplanned power shutoffs? Are you all implementing new protocols, especially given the COVID-19 crisis?
Go ahead and go. We are getting more and more the ability to do, I always forget what the acronym is, the emergency alerts. That used to be very much just for public safety, just for the sheriff's office to use. But more and more, as we see, public health emergencies are also emergencies too. We did attempt to use those on a smaller scale with the last events, but that's one way that we're refining the system to be able to get notice out to people faster. We're also looking at other data sets and other lists of folks that we have, both with children's medical services. You know, we have the Empower data, but there's other data sources for lists of information that we can use to check against the medical baseline list and see who's missing, and then encourage those folks either through the service providers that work with them, their medical service providers, and even their durable medical equipment providers to get people signed up again so that they're not invisible to their utilities companies. So those are a couple of ways. There's many opportunities, low resources. So we're trying ways to leverage the partnerships that we have and the connections that we already have to be able to meet people where they are and get them notified about the systems and about ways that they can hear about what impending shutoffs might be coming their way.
Hi, this is Karen Reluccio. What we've decided to do is to start off our PSPS season with pulling Empower database people, as well as there's an ongoing list of persons that reside on the in-home supportive services list and California Children's Services list. So what we do is we geocode them on a map, and the preparation of that will prepare us for the time when PG&E decides that they're going to do a power shut off, and they ship us shape files to figure out what the areas that's going to be shut off. We are behind on our outreach plan. I think a lot of it is because my entire division is involved in PSPS. We are in our 4th month, so it's been 120 days since our emergency our operations center has been activated for COVID-19. And our intention was to send out flyers to have people prepare, but honestly, we've been derailed because everybody has been involved in this. So we had a plan and we're behind, and this is kind of the challenges that I'm talking about, that has been crippling us in order to prepare people for public safety power shutoffs. I know that there's other parts of the response that public health is not involved in that are, where some of our communities that have had multiple shutoffs are getting prepared to have like a little station installed. But I think our hospital that has been shut off about 6 or 7 times has already been prepared to deal with this. So yeah, so this is the reality. We're not as prepared as we wanted to be. And we're also, trying to rethink, the whole issue about CRCs and sheltering in the midst of, the need to physically distance and to protect people from COVID-19 has added another layer of complexity to this response. And it's overwhelming. I just have to be really honest, just how overwhelming it is to even think about it.
Thank you for that. Yeah, I think we're all feeling exactly that overwhelm. Mark, I'm going to turn to you. If there are ongoing concerns that the de-energization protocols might unfairly discriminate against some classes of people who also may be disproportionately suffering from COVID-19, then how does that implicate the preparedness and quality of the de-energization protocols that have been put into place? And this is a question from one of our audience members.
Well, what I think is important is to make sure that working with public health agencies who have been able to track the people who have been diagnosed, who have been hospitalized with COVID, I think it's important for the policymakers, for the utilities to be aware of this and to look at where the pockets of people are. I mean, as Dr. Reluccio said, the companies make deliberate decisions as to which geographies to shut off. They have maps. And so what's new this year is we have this new situation where we have concentrations of COVID, of people who have been exposed to COVID, of people who have been diagnosed as positive. And because we know how much more difficult it is to do basic hygiene, like wash your hands if you don't have power, because a lot of times you don't have water, okay? That it would be useful for the utility companies to be aware of the concentrations and do everything they can to avoid, to carve out, to protect those areas. One of the things that I think people get really upset with, people who pay higher monthly bills, it seems like our monthly utility bills goes higher and higher, but the service we're getting is less and less and less. And I think what people are expecting is companies to concentrate on high priority areas, do all the wildfire mitigation efforts that they need to do, upgrade the wires, do the proper tree trimming, and then stop shutting off those areas. So if they had a map of these areas with high COVID concentrations, which we know are very heavily correlated with being Black or being Latino or racial drivers, that those are areas that the companies can concentrate on sufficient wildfire mitigation efforts so that they don't have to shut those areas off. So that's what I would recommend as a concrete strategy that pulls together the information we know about where the concentrations of COVID are and what the utilities can do to avoid shutting off those areas as a priority.
Thank you, Mark. Does anybody online have a question, a burning question, and might want to unmute yourselves and ask? Just take a look here.
Hi, this is my name is Junaid Rahman. I'm with the Safety Policy Division at the California Public Utilities Commission. And I'm not sure if I missed my opportunity, but I had a question about the county's involvement with identifying access and functional needs customers, specifically because I'm working on an emergency preparedness proceeding, just updating our how the utilities demonstrate annual compliance with their emergency preparedness plans. And one new thing that came up that became effective January 2020 is Government Code 8593.3.5. And I texted this in the chat room. But basically, it kind of puts a responsibility on the counties to identify access and functional needs customers and communication plans. And what's interesting is that this impacts the commission because now, rather than one of the challenges we had with the utilities is how do you identify and communicate with medical baseline and access to functional needs? And with this new government code, it's almost like it becomes where we have to say, all right, utilities, demonstrate to us that you coordinated with the counties such that if there is a PSPS event or even a COVID-19 event, that you're coordinating with the counties in terms of communication. And the reason I'm bringing this up is I just want to get a feel for if the counties are aware of this and if they're reacting to this.
Thank you. Dr. Reluccio or Stella?
So I feel I'm not as familiar with the exact the requirement, but we do know that working with those who are most impacted by power shutoff, would be the way to go. We want to go to who's the most vulnerable in case of these emergencies. And the best thing that we had access to that we could kind of hone in on who would be the most impacted would be, as Dr. Reluccio and I had mentioned, was that Empower data, because those are folks who rely on the durable medical equipment in order to survive. And those folks, if we get to those folks and at least let them know of, make sure that they're aware of the potential initiation of a de-energization and the duration of that, and make sure that they have backup equipment and can get all of the, make sure that their equipment is going to make it through, and then also that they have all of their basic needs and necessities addressed as well. And then, of course, thinking about the people who may not get that information in a mainstream way that's easily accessible to them. So thinking about as far as communication needs, there's lots of different layers to think about, and
I understand. It's just I think I've been hosting briefing meetings over the past month with the utilities. And because it's so new, some of them were a little unaware of this new government code. And basically it's about outreach. And I believe, I might be mistaken, but we added a new term, access and functional needs, to our PSPS proceeding and decision.
Yes.
And
Yes, we did.
the AFN is, so access and functional needs, it's kind of a new term. It's like almost like a catch-all. And my main goal is, just for the counties not to be caught unaware if this does come up, especially when if the utility is trying to coordinate with the counties, and also in a not so smooth way saying, hey, this is your responsibility, because one of the challenges was privacy, right? Not only how you identify access and functional needs, but how you not violate their HIPAA. And so I don't know, I'm still trying to wrap my head around how this government code is going to be executed this year. That's all.
It's a term that we're extremely familiar with, and for many years we've had access and functional needs committees and representatives of community-based organizations in our emergency management world and in our public health preparedness world as well. So it's not a term that catches us unaware, if that's any reassurance for you.
Yeah, it is.
Good.
Okay, thank you.
Yeah, I think to add to that, Office of Emergency Services at the local level is actually, it's not just public health that's tasked with access and functional needs. It really goes to the emergency management agency in each county. I think that where, there's the intersection between public health and OES is that, we we tend to, in the Emergency Operations Center, we really tend to focus on the medical and health needs of access and functional need population. And I think that we were already, counties were already tasked with having a communications plan with our AFN population. We're required to have, communication in threshold languages, making sure there's American Sign Language, especially when you have, press briefings, or, making sure that our websites are ADA compliant. So there's a whole bunch of requirements are already underway. And I think I guess the unanswered question with this is with COVID-19 in force, how do we do it well?
Yeah.
That's the $1 million question.
Right.
May I have a follow-up question, Gabriella?
Absolutely.
Thank you for my colleagues' question and comments. I appreciate them. I've been very concerned we've been discussing this in particular with PG&E, but also with Edison, of how well they are communicating over the winter and into the spring, because we're already in PSPS. How well the liaison have been established, and how well has the communication been established between PG&E in particular and the counties that are within their service area, which is about 38 counties. And this is one more very important point, that if the counties must be communicating with PG&E in terms of those customers that are in the medical baseline or in the access and functional needs category, and in particular also behind the master meter. So I'm just curious, how is your liaison working with PG&E and with Edison right now?
I know that there's ongoing work groups with our health officer, Dr. Davis. He wanted to say hi, by the way. He was sorry that he wasn't able to join today. So I know that we do have a point of contact who's fairly accessible. I don't, his name is escaping me right now. I know one of my colleagues is online and is in regular contact with him. So we are at least aware of our liaison, and have our health officer does have regular meetings.
I hope so, because that was a glaring error last fall. And how about, is NAPA coordinating really well on a regular basis with PG&E in terms of the different communications that need to go on, and some that are required either by statute or by the PUC?
I think I know who our point of contact is. It's Mark Van Gorder, but I think that there's also other layers of PG&E who are part of the region. About 2 weeks ago, there was a webinar that lasted for hours where they were describing the intention for sectionalization. And I have to say, I couldn't stay for all of it because I had overlapping meetings around COVID. But my emergency operations staff and my Office of Emergency Services staff were on that. So they were reaching out to us to do some updates. And I think the big question is, we're dying to have the sectionalization done to impact of the next power shutoffs come next season, but it just doesn't seem like
the sectionalization will help tremendously, as will the backup power at the prioritized substations. And of course, as Mark mentioned, their vegetation management critical. They will be doing, all 3 IOUs will be holding exercises June, July, and August. PG&E's, and I think you can get this information on their website, PG&E will be doing 3 two-day exercises in the field, not a tabletop, but an actual exercise in June. And I would encourage everyone to involve themselves, particularly the county officials. And Edison's, I believe, are tabletops, and they're in one, I think, in July, and one in one in June and one in July. And then there's going to be, oh my God, I've got somebody mowing the lawn out front. Sorry for the noise.
President Batcher, thank you so much for your questions. I think you have touched on something really important that has to do with communication, access, notification, and our vulnerable communities. And so we'd be remiss not to talk a little bit about the digital divide. Given how important telehealth and telemedicine have become these days, how are public health departments, I'll get to the public health departments after I ask you, President Butcher, what is being done for people without computer access? What is the PUC doing about the digital divide in this respect?
Well, it's a huge problem, Gabriela. And it's one we've all been working on for what now, 20 years? And we still have, and it's come out not that we all didn't already realize how serious it was, but it's been glaring now with the onset of COVID-19. In March, we released a proposal to require communication companies to maintain service for a minimum of 72 hours following an emergency. And these requirements, if adopted, and we're looking at adoption if we vote for them sometime in July, will probably not make a measurable difference in this fire season. But the carriers it's been made clear to the carriers that they have to deploy generators throughout their network that will provide backup. And so in terms of the actual broadband issues, and specifically in with it, what has happened with COVID-19, the biggest near-term problem is whether broadband is affordable. And not every company has an affordable offer. Many are difficult to sign up for and have limited eligibility and may not be sufficient for families that need them. You know, it's one person per household. The reality is that the FCC, the Federal Communications Commission, has largely preempted our authority over broadband. And so we can only urge providers to offer affordable plans. What we can do is improve our state grant programs. And we are working with the Department of Education to provide $30 million for the Wi-Fi hotspot services and devices for students. That is going out now currently from the Department of Education. And my fellow colleague, Commissioner Shiroma, is also working to expand our low-income voice service program, the California Lifeline program to broadband. So that will be very important if we can move the Lifeline program from just wireline to the broadband. It'll be extremely important. But this is a huge issue for us, and it's going to take both at the federal level as well as a state level, and better understanding from the carriers to really address broadband more broadly. The governor is working on a broadband initiative, California for All, and I think that we're going to be making progress. But right now, for COVID-19 and PSPS, there are some challenges.
Thank you so much. Does anybody else in the audience have a pressing question you'd like to ask?
Yeah, this is Jeanette again from the CPUC. Another question for the counties. Specifically, it's about communication. So I've been hearing a lot about coordination, communication, but I was wondering, are the counties using the state standardized emergency management system protocols, or is it still more informal? Because the thing is, I believe in last year, 2 years ago, we have a SEMS, California State Emergency Management Systems, but it hasn't been mandated yet. And one of the things that we're working on at the commission is having the utilities officially use SEMS to communicate top to bottom through government agencies during an emergency. I'm just wondering, on the county level, is that what you're using, or is it a little more quote unquote old fashioned?
It's extremely structured in our ICS and SEMS, and that's really the only way that we can function across agencies is to fall into ICS. So I'm officially the liaison officer for the Department of Public Health. I have to toggle back and forth, because of the length of the response. I have to sort of toggle back and forth between my day job and my ICS job. And but in interlinking with our Office of Emergency Management at the county level and with the medical and health operational area, you know, we have to fall into those common terms and those common sections and organize ourselves and coordinate ourselves across different agencies that way. So it's for the past decade plus, we've been building. It's not for public health. It wasn't you know, the way that we normally communicated, the way that we normally did business, but in working with our federal and state partners over the years in our preparedness efforts, we've really taught all of our staff the ICS and the SEMS, the NIMS systems, so that, and everybody is activated if they're not and even like we have continuity of operations and the folks that have to stay in their regular role and do essential services, and then everybody else is deployed into the operations of our department, which then interlink with the operations of other agencies. So yes, we're very much in that world.
Great, thank you.
Thank you. Does anyone have a question? Someone who hasn't spoken yet? Okay, I have a question. This one was a general question. I think it's an important one given our current context. Right now, the population is being asked to stay home as much as possible. There is civil unrest, which may impact our ability to leave the house further. As heat increases, and stay at home may not be the safest for those without air conditioning. Some may be afraid to open windows. How does the public health, does the public health community handle this?
Well, I think we anticipate that we would have to open cooling centers. You know, the cooling centers, you know, unfortunately are our libraries, of which some of it's closed, but I think that we have to balance the need to protect people from the effects of heat and power shutoffs versus COVID-19. So there has been guidance that has talked about, you know, how to open a shelter or a cooling center with physical distancing and hygiene principles in order to mitigate the effects of COVID-19 in a congregate setting. So that's definitely an area where we would have to really work with our partners and use the standardized emergency medical system to work with our human services agency, which is in charge of emergency service function 6, which is the sheltering part, to make sure that that is done in a way that that is coordinated and we're really going to be doing it differently. I don't think, I think this is where we're going to have to weigh those, you know, weigh the risks as we go forward.
Thank you. Mark, in our closing minutes, would you be willing to provide some advice, any advice you have for public health departments as well as grassroots organizations about how best to impact the PUC?
The California Public Utilities Commission has a number of ways that people can participate, that the public, that agencies can participate. And I'm going to mention 2 of them in the next month. One is that there's a proposed decision that will dramatically reduce disconnections for people who can't afford to pay their bills. And disconnections are disconnections. So on June 11th, there's a public meeting and there'll be public comment. And so if you believe that reducing disconnections is of value when it comes to public health, when it comes to COVID spread, when it comes to just daily life, I encourage you to participate. It's a phone in, it's at 10 o'clock in the morning. This is Thursday, June 11th. The item on reducing disconnections is going to be on the agenda. That's statewide. The other issue is for Southern California Edison. They have a proposal for a significant rate increase. And if you would like to comment on that, and how it may impact communities that you work with. The CPUC has public hearings scheduled for June 30th and July 1st. The information is on the CPUC website, 2 o'clock and 6 o'clock both days, but it's very important to hear people who have boots on the ground talk about how these policies that the PUC is considering, how proposals from utility companies are going to impact communities. So the CPUC, again, has tremendous power and influence on the after housing, rent, or mortgage in some cases. The monthly utility bill is often the second highest bill. It is volatile. It varies month to month in a way that makes it difficult to budget, okay? Your house payment, your car payment, your phone bill are pretty much fixed bills. Utility bills are volatile. They can go up and down a lot. So that's why it's so hard and so easy for people to fall behind. So if these are issues that you think are important, please participate.
Thank you, Mark. I've had one last pressing question come in from Matt Wolf in San Francisco Public Health. He says, I really appreciate this conversation. I want to talk a little about long-term resilience. And this is a question for President Batcher. As the climate changes and wildfires become more frequent and extreme, there may be more needs for power disruption in the future. How can the utilities and the state support local communities to develop resilient infrastructure, especially in places that house or care for vulnerable communities?
Thank you, Matt Wolf, for that question. Resiliency throughout our economy, if you will, when it comes to climate change is absolutely critical. And there are multiple ways that the state is working on resiliency, multiple agencies within the state, directed by this governor as well as previous governors. It's going to take all of those things because the impact of climate change, it's already upon us. We're already feeling it with the increased intensity of wildfires and the intensity of the wind, for example, and the dryness of the wind that helps add to those fires. So the local communities working with the state agencies on long-term plans, both the energy plans to meet a decarbonized state by 2045, as well as what we have to do to be resilient within climate change. All areas of the state are working on it now. The county will be part of every one of those programs, whether it's something out of CARB, the California Air Resources Board, or whether it's coming from the resource agencies or Cal EPA, and the part that we play at the PUC. So this is a long-term effort, Matt, as you said, and specifically, I think you go into each program and find how the state is working with the counties on the resiliency. And this includes Caltrans as well, other areas of state government that have to attack the different impacts that our economy and our individual lives are feeling. So it's long-term, can't be real specific because it's multiple programs that are underway. I will say that there's some real budget impacts right now for our different resiliency programs that are very concerning with a $54 billion deficit that we're dealing with. But resiliency is a top priority for this administration and for many of my colleagues within the administration.
Thank you, President Batcher, and thank you to our panel of experts for sharing your time and your expertise. I also want to thank my co-organizers, Matt Vanderslice, Beth Altshuler-Munoz, Melissa Jones, and Siobhan Sullivan over at BARHII, and all of our participants. We'll be sharing some documents, more information, for example, about that June 11th opportunity to provide public comment. And I want to take a moment just to thank also our Power at Home campaign supporters, the California Endowment, Dignity Health, the San Francisco Foundation, Dean and Margaret Lesher Foundation, and YNH Soda Foundation. BARHII's climate change and health efforts are generously funded by Blue Shield of California Foundation, the California Endowment, and the Kresge Foundation. And with that, I will hand it back to Melissa for a closing thought.
Well, thank you everyone for joining us today and for the conversation about what it means. In particular, I heard Matt Wolf asking, what does it mean for us to plan for long-term resiliency in this time? And so we look forward to actually reconnecting with many of you on that topic and on the topic of the urgent and long-term. So BARHII has been working with the health departments of the Bay Area and with a community collaboration called Rise Together, who joined our team this summer to develop a COVID-19 response platform. And so we have 3 areas, one focused on reopening safely, that includes a focused look at what we need to be able to both continue to respond to COVID-19 and the other things that we know are coming down the pipe. So we'll talk more about that and do more planning with all of you on that. And we have a 4th plank of those priorities that is focused on re-envisioning the systems we have much more dramatically to get to the long-term resilience we need. And so I hope that you'll stay connected with us for all of that. I see that many of you have been able to add your name and email to the chat box. If you haven't done that, that's the way that we can keep in touch with you on this and other topics. And just thank you, Gabriella and Mark, for the incredible partnership, incredible work you've been doing now since the public power shutoff conversation and then processes started last year. I know that it's made a big difference in people's lives and in the ability to respond. So thank you.
We'll be following up later this week, and there is a recording. So if there are others out there who you think might be interested, we are happy to share the recording. Thank you all and have a great day.
Thank you.
Thank you. Be safe, everybody. Thank you.
Thanks, everyone.